So thank you everybody for joining our webinar tonight on destigmatizing the conversation of women's pelvic health. So obviously this is in honor of Women's Health Month, as well as Pelvic Pain Awareness Month being in May. So it works out that we have these two wonderful guests with us tonight. So before we get started with Dr. Fitz and Jessica, I'm just going to give a quick overview of what we'll be discussing tonight. So like I mentioned, this webinar will be recorded and posted on our YouTube channel later this week. So you'll be able to find that link in an email that will go out to all attendees later this week, or you can go directly to our YouTube channel, and we'll also send out the contact information for Jessica and Dr. Fitz if you have any further questions for them after the webinar. So like I said, May is Women's Health Month and Pelvic Pain Awareness Month, so that kind of guided our decision to have this webinar during the month of May. So our goal with this webinar is to provide you with some key takeaways on common conditions. So some of the things that we'll touch on tonight are menstrual pain, dysmenorrhea, IC, endometriosis, fibroids, things like that, as well as understanding how our pelvic floor impacts our bodies and raising awareness overall of various integrative treatments and approaches for supporting our overall health. So just down at the bottom of your screen, there is a Q&A chat box. So we'll have a discussion at the end, but throughout the webinar tonight, please feel free to drop any questions in that question box. If you have a question about anything that is being talked about at the moment, I can read them during the presentation to our hosts, or we'll wait till the end and you can ask them whenever you feel comfortable. And going into a brief introduction of our guests before they get started. So we're lucky enough to have Dr. Bronwyn Fitz, who is double board certified in obstetrics and gynecology and integrative medicine. So in her practice, Women's Integrative Health, she combines traditional medicine with non-Western approaches, nutrition, mind-body therapies, lifestyle interventions, and functional medicine to help women address their health concerns. So thank you so much, Dr. Fitz, for being here tonight with us. And Jessica Klecki is a physical therapist with a pelvic health specialty here at Performance. She is based out of our New Canaan office. She works with both female and male clients to create a comprehensive treatment plan for pelvic health issues by incorporating various exercises, stretching, and breathing techniques. So again, this will all be recorded and everything will be sent out later in the week for you. So I'm going to go ahead and hand it over to Dr. Fitz so she can speak a little bit more on her background and get into some of those integrative approaches that she implements.
Yeah, thank you. Thank you so much for having me. I'm really excited to talk this evening about pelvic health, which is obviously near and dear to my heart as a gynecologist, and women's health in general. I love women, and I love taking care of women. And in my background, I'm traditionally trained OBGYN, and I practiced for many years and sort of came up against a wall a little bit eventually, just sort of getting tired of like, okay, hormones, pain medicine, antibiotics, surgery, like that's all we have, really? Is that it? And the answer is no, that's not all we have. But that's really what traditional Western medicine focuses on. And there's so much to learn that then, doctors get stuck in just that little bit of information they learn. So my interests in meditation and mind body medicine led me, and also food, I'm a foodie, I love food and nutrition, led me down the path of really wanting to learn about these modalities and how to incorporate them into a medical practice. And so I did my training in integrative medicine and functional medicine. And so just to clarify, integrative medicine is really sort of a big picture, like a big concept of really just being open-minded and being open to all potential healing modalities. If it works, let's use it. So that includes Western medicine, but also includes Chinese medicine, Ayurveda, aromatherapy, homeopathy, energy healing, like anything that works. And functional medicine, I think of as kind of a subset underneath integrative medicine. For those of you who haven't heard of functional medicine, it's really kind of the thought process of getting to the root cause of what's going on. So instead of just saying, oh, you've got PMS, take this, or, you've got irregular periods, go on the birth control pill, that'll fix it. really sort of trying to drill down and figure out why, like what's driving this. And so functional medicine really works remarkably well in women's health. And we'll talk a little bit about it later. But to dive into this evening's topics, we were talking ahead of time and decided, let's just give a really brief overview about the menstrual cycle, because it's something that we're all very familiar with, but many of us don't know the whole physiology. So if you want to pull up that slide, I'll just show you. Just to put it in perspective, because when people come to me and they have a complaint, like I have pelvic pain or discomfort or bloating, one of the first questions I always ask them is, where in this cycle are you feeling this symptom? Because it really helps me figure out, what's going on. So on the slide, you can see the first half of so day 1 is the first day of your bleeding. So days 1 through 7 is the typical period. That first half of the menstrual cycle, the first 14 days, if you look at that top, like sort of pictogram, you see the estrogen is that pink line going up. So the estrogen starts out low and kind of gradually gets higher. And then right before ovulation, which is that pink bar right in the middle, the estrogen really spikes. So we think of this, that follicular phase, the first half, as kind of an estrogen dominant kind of half of the cycle. I'm already getting a tickle in my throat. Sorry, we were talking about allergies as well. So that pink bar in the middle is ovulation. So if you have an ovulatory cycle, we ovulate, and then with ovulation, your body makes progesterone. Only if you ovulate do you have that nice progesterone surge in the second half of the cycle. So we need that balance of the estrogen and the progesterone. But in terms of, when someone's experiencing pain, the kind of regular menstrual pain, we might call it dysmenorrhea or cramps, happens during menses, right? So during your period is when most people feel that. If someone comes to me and they say, I'm having, lots of pain before my period, then I'm thinking more, maybe endometriosis or adenomyosis. Adenomyosis is going to get worse during menstruation also. So there's a lot of different things that could be, causing discomfort or pain. If you want to run to the next slide, I'm not going to go through every single kind of medical thing, but we will touch on a few things. So endometriosis, if people aren't familiar, that's when cells of the uterine lining land on other parts of their insides. Can be on your bowel, can be on your bladder, can be on your fallopian tubes. And with periods, it's very painful. It's very inflammatory and very painful. Adenomyosis is when those uterine lining cells actually get it stuck on the inside of the uterine muscle, and likewise gets very painful during periods. But lots of other things. People come to me with other complaints as well. Fibroids, ovarian cysts, sometimes irritable bowel can present as pelvic pain. There's a whole spectrum of bladder, painful bladder syndrome. We used to call it interstitial cystitis, and I think there's a bit of a switch going on calling it painful bladder syndrome. People also come to me complaining of pain with intercourse. So pain with intercourse, pain with sex can be any of those things. Can be adenomyosis, endometriosis, can be vaginal dryness from lack of hormones, can be any number of things. Let's touch on red flags first, and then I'll talk about integrative approaches. So yeah, we wanted to mention just red flags. I mean, there's this sort of sense of like, oh, just grin and bear it. Like, I've got my period, it's that time of the month, I'm grumpy, it's horrible. Like, we don't have to just grin and bear it. Like, I don't want people to be suffering so much that they're, missing, work. They're not as functional as they can be at work. They're missing school. If, these things are impacting your relationships, certainly if it's, impacting your ability to have sex with your partner. these are big red flags. Get help. You don't have to suffer that much. If you're taking pain medicine, nonstop. We'll talk about, pain medicines and herbs in a minute. But the real red flags, there are several pelvic emergencies: appendicitis, ectopic pregnancy. So if you have like 10 over 10 doubling over pain, fever, especially if it's associated with GI complaints like vomiting, definitely go to the ER at that point. It's amazing to me how many people do end up in the ER with period pain. It's a really big problem. But so let's talk about sort of what I offer, the difference between traditional and integrative approaches. I mentioned before what our main tools in the toolbox are in traditional medicine. It's hormones and hormone blockers, birth control pills, and things like that. And there's definitely a role for that, especially if you need birth control. I mean, if you need birth control, then a lot of times it's sort of like a 2-for-1, and that's why a lot of people end up just going on the birth control pill. But it's not necessarily addressing the root cause of what's going on. So while I do prescribe birth control pills and recommend IUDs and things like that, I always let people know, I like to let my patients know that it's not a total Band-Aid, but we're not addressing the root cause. So we need to still work on the other things that are driving the symptoms. So hormones, anti-inflammatory medicines, surgery, antibiotics. Of course, when we get into integrative medicine, we have alternatives for some of those things. I use herbs. I do use antibiotics, but I often use herbs as well. But they're antimicrobial herbs. They're herbs that, kill bacteria and viruses and yeast and things like that. What else? So, and then in terms of anti-inflammatory medicines, there are anti-inflammatory herbs. We've got ginger and boswellia and turmeric, and there are lots of great blends. And so sometimes I'll put people on almost like an herbal ibuprofen kind of thing. But again, that's a little bit of a Band-Aid. That's just kind of like substituting an herb for a medicine. What we want to do is figure out how to lower the inflammation from the get-go. Like why are people so inflamed? So we in integrative medicine, we talk a lot about the anti-inflammatory lifestyle, eating an anti-inflammatory diet, avoiding processed foods and sugars, eating lots of wild salmon, getting lots of good healthy fats. It's amazing what food and nutrition will do for your overall health, especially young girls who come in, the teens who they haven't sort of had that awakening about nutrition. And if we can improve their diet, period symptoms get much better. It's really, really, really rewarding. It's amazing. So the other thing that we do in functional medicine, which is sort of getting to that root cause, is we think about from the hormone perspective, because we looked at the menstrual cycle and we talked about estrogen and progesterone. So if someone has a hormone imbalance, again, the question is why? What's going on? So in traditional medicine, we don't talk about toxins and environmental toxins, but we're all about toxins in functional medicine. And, there are so many chemicals that we're exposed to in our everyday life that actually act as estrogenic molecules in our body. And so they're driving this estrogenic response. So chemicals in plastics, pesticides in the food we eat. And if you think about all the food that we eat that's wrapped in plastic in the grocery store, I mean, these things kind of leach onto the food, sadly. So, plastics and pesticides and even chemicals in the water that we're drinking, the exhaust from in the air we're breathing, you know, from the automobiles, but then also for people who live near kind of industrial areas, they're getting a, you know, much bigger hit. So all of these things, number one, they're important because some of them act like hormones, okay? So we can have extra estrogen, not to mention dairy. You know, dairy should be eaten very sparingly, if at all. And I say that lovingly. I love cheese. I love ice cream. But cows, even organic, you know, free range, grass fed, happy cows, they just had a baby and they're lactating and they're producing milk. They're full of hormones. They're full of cow hormones. And so those hormones, when we ingest them, they're acting like hormones too. So, you know, for a lot of these processes that are driven by hormones, fibroids, dysmenorrhea, adenomyosis, adenomyosis, where we've got an excess of estrogen, we want to really limit how much extra environmental estrogen we're being exposed to. The other piece of detox, or thinking about toxicity, is we need to, once these things are in our body, we need to get rid of them, right? So the liver is the main organ of detoxification, and you know, is the workhorse of detox, and it's got lots of enzymes that are processing and metabolizing and pushing things into the GI tract, and we eventually poop it out or pee it out. Some goes to the kidneys for pee, some goes to the, you know, the GI tract to get pooped out. But these same pathways in the liver that are processing all these toxins are also processing estrogens. And so there's like a rate limiting capacity for the liver. Like if the liver is overwhelmed, it can't even clear out things very well. So in functional medicine, we really focus on how are your detox pathways working? Are you having 1 to 2 easy bowel movements a day? That's one of the, I mean, we talk a lot about poop in my practice. It's like, how's the poop? Because if you're constipated, you're not eliminating all those toxins and all those extra hormones that your body needs to get rid of. So, you know, the other piece, I mean, I could go on and on, but the other important piece is the microbiome. So all of the bacteria and viruses and parasites and things that live normally in the GI tract, they help us metabolize our hormones. They can help us or they can hurt us. So we want to have a healthy gut microbiome. So that's another thing that, you know, even if a woman comes to me and she's got complaints about her period, we're going to be talking about her digestion. We're going to be talking about her gut health. We're going to be looking at her stool microbiome. And then we're also going to look at all of the other sort of main pillars of health that affect your health. So I think about nutrition, which I mentioned. Stress management is huge. I mean, I could talk for hours about cortisol and how it relates to the menstrual cycle, but I won't, I'll spare you. But stress management, sleep, you know, that recovery. We talk about exercise, movement, and then the social and emotional and spiritual. So, you know, in my practice, you get it all. Like we talk about it all, and I feel very strongly that these are really important. And if you can optimize all of those things, you know, whatever's going on period wise, we're gonna whittle away at it and make you feeling better in a meaningful way. But the other thing so this is going to segue back to Jessica in a minute, is, you know, the other really important thing about pelvic health is just recognizing that these are all muscles we're talking about. You know, the pelvis is a giant basket of muscles, but the uterus, if we're thinking about endometriosis, adenomyosis, fibroids, dysmenorrhea, the uterus is a giant muscle, right? The bladder, if you've got bladder pain, the bladder is a giant muscle. So how the muscles function or you know, don't function very well is super, super important. And that's where the pelvic therapy, the pelvic floor therapy, can be a really important add for, you know, a treatment plan. So I'm not an expert in the musculature, so I'm going to, at this point, pass it on to Jessica.
And Dr. Fitz, actually, real quick, we do have a question that either you or Jessica could answer, but do you think that there is a stigma around raising concerns about menstrual pain? Do you think that, you mentioned that some women think they need to grin and bear it. Maybe women are used to people telling them, oh, it can't be that bad. So they play down the pain they're in. Do you see that people try to kind of minimize the pain and don't talk about it?
Well, absolutely. And even as a doctor, I mean, I've seen it my whole career. I mean, doctors minimize it, patients minimize it, everybody minimizes it. And, there are some people out there who don't experience a lot of pain. And so there's maybe a little bit of a lack of, kind of understanding that how bad could it be? But, you know, the one thing I tell my patients is that, hopefully everyone can find a healthcare provider who listens to them and honors what's going on with them, because I feel like my patients know their body better than anybody. Like, they can tell me something and I'll believe them, but still they are the boss. They know what's going on. And so you really need to hopefully find a provider who you can be completely open with, and who gets you and is willing to work with you, and accompany you on the journey to wellness, because you shouldn't have to be in that place of despair.
Perfect. Thank you. So Jess, if you could either add on to that, or we can move into kind of the musculature of the pelvis itself.
Sure. Oh, excuse me. Now she had a tickle and I have a frog. Sorry about that. No, I think Dr. Fitz answered that question beautifully, and I agree with everything she says. And it's nice to hear some of the things that I'm saying over and over again kind of told back to me. It's nice to know we're on the same page. So hi, everyone. I'm Jessica. I am a pelvic health physical therapist. And most of the time, the first question I get is, how in the world did you get into this and why? So I will answer that very quickly. I was in physical therapy school, and I thought I was there because I wanted to treat athletes, just like the majority of people who decide to go to physical therapy school. And we're sitting in class and we have a very, very short lecture on what pelvic health is, just to give us the idea that, hey, this thing is out there, it exists. And the lecture more or less blew my mind. I had no idea that this was in the realm of practice for physical therapy, and I just thought it was really weird. So of course, I wanted to learn more about it. So I asked to have an internship that specialized in pelvic floor, and I was given one in my last year of school. And so I shipped off to Savannah, Georgia, and I had an absolutely wonderful internship with a really brilliant mentor. And it's not the act of pelvic physical therapy that brings me back every day. It's the fact that these people this is like their last line of defense. They have no one else to go to. They've been to 8 doctors. They have no hope. And not everyone, but you get those who they have no hope. You're their last hope. And is all I do differently is listen to them. And sometimes just the 20 minutes of my time that I give them to really listen and understand what they're saying can totally change their mindset. And that's what brings me back to work every single day, is that I can give hope to just one person who felt like they had to live in pain, or that they can't go to the grocery store because they have massive leaks. I can be there to help fix that. And that's what really helped drive me to become a pelvic floor physical therapist. So since I graduated from school, I've been treating pelvic health patients. I started with just women, but now I treat men as well. So when I get into the anatomy, it's important to know I'm talking about a female anatomy right now, but men have pelvic floors too. And theirs looks just a little bit different, but mostly the same. So what is pelvic health physical therapy? Kind of like Dr. Fitz, we focus on the whole person. We're looking at how multiple systems work together. So we're looking at your GI system, your reproductive system, urologic, neurologic, dermatological systems, and how your orthopedic systems work together. And that's where physical therapy really comes into it, is that orthopedic side of things, how all those other things fit in with that. And so we have a really lovely picture of a core, which is where I'm going to start, because I can't get to the pelvic floor without kind of telling you how it makes sense with the rest of the body. So I have my fantastic LaCroix can here to help us out. And as you can see from the picture, the core basically looks like a can. So you have the respiratory diaphragm at the top. The diaphragm works by pulling down as your lungs inflate. and then it risks back to neutral as the lungs deflate. So that's a very important mechanism for us to be working with in pelvic health, because if something is pushing down from the top, it's probably affecting what's down at the bottom. And at the bottom of our can, we have those pelvic floor muscles. So just like the respiratory diaphragm with your breath, they do move a little bit, just like the diaphragm. They move down and they rest back up. So we have the top and the bottom. The front of the can is going to be those core muscles. On this picture here, they really only have listed one, that transverse abdominis muscle. And they've listed that one because that one tends to be forgotten. That rectus femoris muscle in the front is that six-pack muscle that everyone wants to look nice at the beach, but isn't always the most important one for stabilization. So this transverse abdominis kind of reaches across the whole can instead of just a very small portion. So that's why it's going to make up our front. The back of our can is the multifidus muscle, or really the multitude of lumbar stabilizers. But this picture has that multifidus, which is very important and often gets overlooked and forgotten. So we'll stick that on the back of our can. So now we have this whole picture, how our whole abdomen really works together. Diaphragm on the top, pelvic floor muscles on the bottom, the core and the lumbar spine, and those muscles that stabilize it. So now I'm going to show you kind of what that looks like in sort of a better real life picture. So I have my lovely pelvis here. So just to kind of navigate you on what we're looking at, it would sit down in my lap just like this. So we'll start with this big hip bone that we have on the side here. So we call this the innominate, which basically means it has no shape, an unknown shape. And this hip bone is made up of three parts. We call them the ilium, the ischium, and the pubis, which might sound familiar if you've ever had pain at your pubic symphysis, where those two pubic bones come together. In the back, we have the very low back, or that lumbar spine, which is going to come down to the sacrum, and then the coccyx, or the tailbone. Now, the reason all those parts are important to us is that everything else in red on this model is a pelvic floor muscle. So you can see that they act kind of like a hammock. They're going to go from front to back and side to side, and they sort of really fill up this bowl. The reason that they form this bowl shape is that one of their main functions is to support all of your internal organs from falling out the bottom of your bowl. That's kind of important. So you actually have muscles there to support you, which most people don't realize, that it's not just this empty hole where your poop and pee comes out of. There's muscles. All right. So that's our first S for function, is support. All right. Now, if we take a better, closer look at these muscles, you can start to see the shapes that they take. All right. So to kind of orient you here, we have the urethra, the vagina, and the rectum. You can see that the muscles actually start to wrap around each one of those openings. So our second S function is going to be that they act as a sphincter. They're sphincteric. They're actually your voluntary control so that you don't leak unwanted urine or stool. They also, as you can tell, they can kind of start to wrap around. They wrap around the vagina opening as well. So these muscles are also super important for sexual function and arousal and orgasm. So that's our third S, sexual. These muscles also act to help as a what we call the sump pump. We use that term because it helps to make our fourth S, but they help to bring back lymphatic and blood flow from the bottom part of your body. It really helps to pump things back to the heart, to help with swelling and congestion kind of in the pelvis. And our fifth, we're on five already. Our fifth function is that these muscles, they stabilize this pelvis, right? They're the bottom part of the can. So they really, really provide that stabilization from side to side. So say you're going to stand on one leg. The force from the ground, the force from having to stand on that one leg, has to travel up from the ground all the way up your leg, across your hips, across the pelvic floor, and up into the low back so that you don't fall over. That is how the force is manipulated and moved. These muscles also have to help stabilize your intra-abdominal pressure. So if you've ever seen a weightlifter who tried to lift too much weight and held their breath and passed out, that is because they're valsalvating. They held their breath, it tanks their blood pressure. But the reason they do that is by doing that, they they make a sort of fake stabilization because they're lacking true stabilization, which these muscles can help to provide you. So that's kind of our breakdown of the anatomy. There's a lot of muscles, and I could go through all of the really fun names of them. A lot of them kind of sound like Pokemon names. So bulbospongiosis, that's my favorite one to point out to people because it kind of makes them giggle. But the main muscles that you'll hear talked about are going to be the levator ani group. And so that's the group that most of the time when you're focusing on strength and endurance, those are the muscles that are going to provide that for you. They're the bigger, bulkier, deeper set of muscles. The more superficial muscles are going to often be talked about more if you're having pain with intercourse, because they're the ones that are kind of blocking our entry. So I'm going to start talking a little bit about our different classifications of maybe why you would come to see me, how I consider your symptoms to be grouped. We do have a 2D picture of those muscles. We can throw them up really quickly just to kind of show you, if you Googled it, what a picture might look like. Again, this is going to be a view from the bottom. So we're kind of like looking up at this person, and this is going to be their stomach at the top and their buttock or their bottom kind of down here at the bottom. So working your way down, again, you'll see the urethra, the vagina, and the rectum. So you can kind of orient yourself there. As you can see, those muscles, they do move and they are in different shapes. So some of them do wrap around kind of like sphincters. So it's kind of nice visual to sort of really see that for yourself. All right, we can get rid of that. All right, perfect. So let's talk about the different classifications. So Dr. Fitz talked about diagnoses, which are super important, and we talk about those in pelvic PT as well. But we will classify your not just your symptoms, but our findings that we find in kind of 3 different categories, typically. Sometimes there is crossover, but we'll diagnose either like a hypotonic pelvic floor, which basically means those muscles don't have enough tone. They're lacking strength. Just like your muscles at your bicep muscle. If it's weak, it's not that big. It's not as big as your friend who lifts 200 pounds at the gym. They have nice, bulky, thick muscles. If you're a little weaker, the muscles are a little thinner. They don't take up as much space, and they're just not doing their job efficiently and well. You lack endurance, and most of the time you can't perform that, what you might call a Kegel exercise. So we tend to call them pelvic floor contractions, but it's the same thing. It's kind of squeezing and letting go of those muscles, or trying to prevent the flow of urine, as it's been kind of classified in the past. We can test that strength, and those hypotonic pelvic floors, they're just not strong. They just can't do it. A hypertonic pelvic floor is going to be the exact opposite. That is someone who there's so much tone in the muscles that typically they're painful. You can think of it as those muscles are being held tight, and oftentimes if those muscles are held tight, they're also weak. So that's where things kind of can get confusing, is someone with a hypertonic pelvic floor can still have leakage, but Kegels are not your answer. So that's why it's really important to seek treatment for these things and get an assessment, at least, is that there isn't just one right answer until you know what's actually wrong. Because if you think about it, if you held your arm like this for 5 hours, and then you tried to move out of this position and curl even 5 pounds, you probably would not be able to do it because your muscle has been held in that shortened position for too long of a time. So what you would need to do first is get that muscle out of that position where it could work more efficiently again. So typically a hypertonic pelvic floor is going to be your pain patients. So your patients with pain with intercourse, or even potentially constipation patients. If those muscles are too tight, remember, they wrap around the rectum as well. And so if you can't get stool out because those muscles aren't relaxing, then you're going to have a problem. So there's a lot of different diagnoses who can fit into my different categories. My third and often most confusing category is what we call dysenergia or dysenergic muscles. These muscles just they're not firing at the right time. They're not doing what you want them to do. So oftentimes we see these as constipation patients, because that's just how it happens to present. That's how they end up to us, is that someone is having a really hard time with bowel movements, because when they think that they're relaxing and trying to pass stool, those muscles are actually tightening up. And this is not a voluntary thing. It's not like they just can't get the coordination right. This is that the sphincters are actually firing on their own as well, and they're just doing the wrong thing. So these people are a little different. Usually they also come with some hypertonicity with that, because when things aren't firing at the right time, muscles can get a little irritated and kind of hold in that tightness. So if you've ever had like a muscle knot in your shoulder, it's kind of the same thing. If your muscles aren't happy, they're going to kind of start to build those muscle knots. And so those dysenergic muscles can be, the dysenergic patients can be quite challenging, because you really have to focus on the coordination of movement and breaking that pattern, which can be very interesting. But when someone finally has a really easy bowel movement and they come in very happy, it makes it all worth it. You don't realize how lovely it is to have normal poops until you don't have normal poops. And I'm glad that Dr. Fitz also talks a lot about poop, because it's you got to talk about poop a lot. So those are our three main types: is the hypo, the hyper, and the dysenergic. And so when you come into pelvic floor physical therapy, we talk a lot. We get a lot of your background, because not only am I looking at the orthopedic side of things, and I'm looking at how do those muscles work, right? I'm also trying to figure out how does your GI, reproductive, urologic, neurologic, and dermatological systems fit in with that. And so oftentimes, if you have a really great doctor with you, that's super helpful, because you're already coming to me with more information than you could have provided on your own. And so that's really great. But sometimes just digging and getting a background on habits, how much water are you drinking? When are you drinking the water? How often are you eating? What do your poops look like? What are your habits, and how can they be affecting you? We also talk a little bit about diet. I don't get into it as in depth, and it's great to have a resource who can do that. But there are small changes that even as a pelvic floor physical therapist, we can help to implement to make things easier. So when you come in, we take a look at your whole body. I check the back, the hips, the legs, see how things are all kind of fitting and working together. And then we start to make changes. And a lot of times the habit changes are the hardest part. So you come to me for the treatment, but you have to put in all the hard work on your own of kind of changing things that weren't benefiting you as much as you would like them to. And the last thing that we really focus on, because it's just such a high incidence of the two things occurring together, is stress management, which is super interesting that Dr. Fitz was stressing about that as well, is that oftentimes pelvic pain patients, especially chronic pelvic pain patients, they're the ones who are dealing with very chronic stress and anxiety. And what came first, the chicken or the egg? It's kind of hard to say. Are we stressed and anxious because of the chronic pain, or are those two things kind of coming and going hand in hand? So we work on meditation, we work on relaxation, and a lot of times doing simple breathing exercises just to calm down the nervous system is enough to help to start to relieve that pain. So pelvic floor therapy definitely is a little outside of the box of your regular PT, not just because of the area that we're working on, but because we really try to fit in the whole picture as best as we can, which I think helps a lot with not just your pain, but kind of understanding the whole person and making them feel understood and cared for, which is what we're here for. So
going off of that, I mean, obviously these are topics that both of you are very comfortable talking about. Do you feel like talking about these conditions and symptoms and what you're talking about, the holistic view of women's health, is becoming more commonly talked about in, both general public with like friends and family, as well as in the medical field?
I think slowly it's becoming more talked about. It's definitely, I think, been a long time coming. It's been very slow. But I think women are feeling more comfortable talking about it, and, you know, mothers talking to daughters, and daughters talking to friends, and being more comfortable talking to your doctor, and your doctors being also a little more open to different ideas, I think has the situation is a little easier to bring up now than it was 30 years ago, for sure.
Yeah, it's hard. I think that, you know, women, of course, women will talk to women about things much more liberally, but, you know, menopause, fertility, people will talk about, but, you know, when it comes to pain, it's really, you know, I think there is a big stigma. I think people are embarrassed, and, you know, you're talking about like your period, your bleeding, your vagina. Like, I just think that it's still kind of not really, like, I was just mentally, you know, thinking like, have I ever had these conversations with my very best friends, like some of my girlfriends who I loved, like, well, one of them's a midwife, so we talk about everything, but but no, I mean, you know, even with family and friends, you know, I think people they kind of like monitor, and they sort of self-censor a little bit, sadly.
Yeah, no, for sure. You're definitely right. Now, like, right, you're like thinking about it, you know, it's easy to talk about, you know, as a whole, like, oh, you know, this is period and the information. But then when you actually have to talk about yourself, you're like, I don't know that I've really ever brought up, right, how I feel during my period with my friends. So no, you're definitely right.
Yeah.
I think it's really interesting too to hear both of your perspectives about how you bring it into, for example, performance optimal health are 4 pillars. So, you know, nutrition, exercise, recovery, and stress. And then Dr. Fitz brought in, you know, her 5 pillars. So really those 4 plus that, you know, emotional, spiritual side of things. Do you feel like that has been coming more into the conversation of, you know, not just looking at somebody from that medically, physically perspective, but also going at it from that overall holistic optimal health perspective?
Well, I think it is, it's what people want. I mean, it's what people need, and it's what people want. So certainly people who find me, that's what they come for, because like my new visit is 2 hours, and we just like ridiculously long, but I feel like it's a fantastic experience for them and for me to really get to know each other and establish that, you know, therapeutic kind of relationship. But you know, I'm so thrilled that meditation is much more mainstream than it was even 2 years ago, 5 years ago. I mean, when I got into it, you know, the idea that a doctor would bring up meditation was kind of crazy, and it is creeping its way into mainstream, which is amazing. You know, I'm very pleased that it is.
Going off of that too, it looks like somebody asked a question, going back to what you had said about nutrition earlier, and anti-inflammatory diets. Do you have like a list or recommendations for like the quote best foods or worst foods for women's health that people should, you know, try to incorporate or oppositely try to avoid?
Yeah. So yeah, you know, I will say that nutrition, it's sort of an overarching concept that I do think that nutrition needs to be personalized, and there's not one perfect diet for, you know, people are very individual and people have sensitivities and things like that. So, but with that said, I guess there's 2 main concepts. There's kind of an anti-inflammatory diet, which, and then, so if I forget, make me come over and we'll talk about hormone friendly foods. But in terms of anti-inflammatory things, you really want whole foods, and you think bright colored foods. So I tell people eat all the colors of the rainbow in vegetables and fruit every day. So red, orange, yellow, green, blue, purples, kind of one family, and then beige. The beige vegetables are like garlic and onions and chickpeas and things like that. You know, eating whole foods, eating 1 or 2 of all of those colors every day in fresh vegetables and fruit is amazing. You want healthy fats like salmon, you want wild caught salmon, you know, nuts, avocado, olive oil is like, you know, the elixir of life. I love olive oil. And fermented foods, and the things you really want to avoid, like if you could take one thing out of your diet, is sugar. Anything with added sugar is so inflammatory. So I would say, of course, I like a sweet, I have a sweet tooth. So I don't, of course, no one's going to like remove it 100% of the time, but you want to, on a daily basis, avoid things that have added sugar. What else was going to, so hormone, and dairy. So I mentioned before, dairy is full of hormones. So hormone friendly food, we're going to avoid dairy, in terms of helping estrogen, and estrogen metabolism. The cruciferous vegetables are amazing. Broccoli, cauliflower, cabbage, kale, arugula. Eat a couple of servings of those a day. It's really, really good for estrogen. Flax seeds are amazing for estrogen. They're also a great source of fiber to keep your poops regular. Some of the other plants that have beneficial phytoestrogens are like soy, organic soy. Some people shy away from anything because they think they hear the word phytoestrogen, which means plant estrogen, and they think they need to avoid it. And so what I tell people is, if you look at the data on soy, granted, some people don't tolerate soy, so it's not for everybody, but the data on soy is really good. The women who had lifelong regular soy intake have less breast cancer, overall. When you're young and reproductive and having periods, those very, very weak estrogenic like compounds actually block your more potent estrogen. So net lowering your total estrogen exposure. So that's how it's helpful to decrease breast cancer. And then once you're postmenopausal and you don't have a lot of estrogen circulating anymore, those little bit of extra phytoestrogens are beneficial and give you a little boost. So I like soy for young women, for older women, all ages, as long as you tolerate it and it's not irritating to the, your GI tract.
Awesome. Thank you so much for answering that. I think that was really thorough. I think that's really helpful for everyone listening. And kind of going back to the pelvic floor, so throwing it back to Jessica. So we had a question about how do you know when you should start working on your pelvic floor? So age-wise, is there an age that's too young or too old to start working on your pelvic floor health?
I mean, I would say like you're never too old. Like definitely there can be progress made. Even if you're 80 and your tissues have atrophied, they become very weak because you are menopausal or postmenopausal and have not a lot of estrogen. You can still start to work on those muscles. So there's definitely no age that is too old. I mean, we don't need to have small children going around doing Kegels. I think like that's a bit much. But once women start to become sexually active and are kind of seeing how that is going, then I think that's when you kind of know like, are my pelvic floor muscles are okay. I mean, if they're having pain with intercourse or pain with trying to insert tampons, that sort of thing, then that's when you would seek care for sure.
And kind of going off of that, some people talk about, I know in the beginning you mentioned incontinence and leaking very briefly, but I think a common question that people wonder is leaking or incontinence, is that normal? Is that genetic? Are you kind of just stuck with it? Can you help that?
No, I'm just going to yell it louder. Can you give me a sign that says no? I don't care if your grandma leaked, if your mom leaked, if you had 12 kids, you do not have to leak. There are answers. Even if those answers aren't just seeking me, a pelvic floor physical therapist, there are answers for you. You do not have to deal with it.
Right. I think that's loud and clear right there.
You think so? Should I get a sign? I'll get a sign.
Perfect.
No leaking.
No leaking, yes.
And then I know one more question that had come in. Can back pain be related to your pelvic floor? I know a lot of it, you were talking about kind of the pelvic muscles. Can back pain be related to that?
Yes, absolutely, it can. So I didn't touch on that there are very deep hip muscles that lay very closely with the pelvic floor muscles. And so those deep hip muscles can actually be accessed internally, just like I can access the pelvic floor muscles. And sometimes those little tricky hip muscles can be contributors to low back pain. There also is other other reasons, C-section, scars. I mean, there's a lot of things going on. If there's no stabilization here, there's definitely going to be compensations. So there are probably 300 reasons why your low back pain or hip pain could be pelvic floor related. It might not be, but if you have done everything orthopedically and things aren't making sense, and your back and hip pain aren't getting better, then definitely or if it came on during pregnancy or after giving birth, definitely those things could be pelvic floor related.
Perfect. Okay. And just a reminder to everyone, with a couple of minutes left, if you do have any last minute questions, please feel free to drop them either in the chat or the Q&A box. We'll be sure to get to them. But as we're kind of wrapping up, Dr. Fitz or Jessica, do you guys have any, major takeaways that you guys want people to, implement in their daily lives or kind of take away from this conversation tonight?
Yeah, I mean, I think just revisiting the kind of the pillars, like your 4 pillars or my 5 pillars. I always start with food as just a foundation of health, like what we put into our body, like literally we are what we eat. I mean, it's such a cliche, but what we put into our body is what our body is made of. And so just be really thoughtful about and mindful about your choices. And then, the next thing that I would say is your digestion and your digestive health, which is how your body gets that nutrition inside so that we can sort of, assimilate and transform it into, energy or whatever we make hormones, we make neurotransmitters. That whole process has to be working. So that's just such an important foundation that I think traditional medicine just kind of really overlooks. Of course, the gastroenterologists don't overlook it, but it's foundational even for women's health.
Actually, I'm going to cut right in here. We did actually have a question come into the chat. So I think this may be a question more for you, Jessica, but what about your pelvic floor kind of dropping out? So, surgery, et cetera, after kids, can you touch on that a little bit?
Sure. So I think this person is probably asking about prolapse. So definitely there are different degrees of prolapse. But one of the functions of the pelvic floor is to support, right? So as muscles get bigger and stronger, they take up more space. So with pelvic floor therapy, we're not going to correct the prolapse. That could only be done through surgery. But with pelvic floor physical therapy, you can strengthen those muscles to help support that prolapse better so that your symptoms disappear or are much less. We see really good results all the time with people who have prolapse. Sometimes they do like a pessary, which you can be fitted for one by a gynecologist. Sometimes they just use them for running or high impact exercise. But there's definitely a lot of education that goes around a prolapse. And a lot of it has to do with talking about how you're pooping and how you're dealing with pressures. Because just like this can, basically your bottom has gone down, right? And so if we're holding pressure in the can, it's going to push down on the bottom of my can. And that's things that we want to avoid. So we would definitely discuss how to avoid making it worse and potentially how we could get it feeling a whole lot better.
Is there a way to prevent prolapse, or is it more of like a kind of retrospective, you kind of help it afterwards?
No, definitely learning how to lift properly, learning how to not hold your breath and breathe with positioning and exercises, learning how to not strain when you're pooping are definitely ways to help prevent prolapse. If you're in labor for 24 hours and you're pushing really hard and it's just not going well, of course, there's not a whole lot that you could have done to prevent that prolapse. I mean, that's a kind of different story. So that would sort of be in retrospect. But if we can help you use your pelvic floor muscles more efficiently prior to pregnancy, then the labor may have been a little easier. So there definitely are ways to prevent it, but it's not your fault if you have a prolapse. Sometimes it's just, you had a really hard labor, or you just didn't know how to work your muscles and control your intra-abdominal pressure properly.
Perfect. And then we also have another question kind of for both of you, I think could touch on this, but could you talk about some recommendations to relieve pain with intercourse in postmenopausal women? So including issues related to vaginal dryness without medication, for example.
Yeah. So there's a number of strategies. The first thing that a lot of women reach for is an over-the-counter product, and there's sort of classifications. There's moisturizers and there's lubricants. And so a lubricant is something that's just going to help with the act of intercourse, giving a little slippery so that maybe there's not as much friction. So certainly that's kind of one of the first things that, some women will do, postmenopausal or not postmenopausal. The lubricants are not meant to be therapeutic to the skin. And so then if you want that, you move towards like a vaginal moisturizer. There's lots of amazing products now online. I have a whole list of brands, but some of those have sort of natural healthy oils. Some of them have coconut oil in them or olive oil in them. If you come to someone like me, I work with compounding pharmacists, and we can put together a compounded medicine that might have, I know you said you didn't want medicine, but hyaluronic acid, which is also something you can just get over the counter as a vaginal preparation. It's the same hyaluronic acid we put on our faces, that you can get hyaluronic acid for the vagina. They have it over the counter. It can also be prepared by a compounding pharmacist, and that really helps just bring moisture into the vaginal tissue again. I'll put a plug out there for topical estrogens, either estradiol or estriol. That's going to be sort of the gold standard in terms of rejuvenating the tissue, the vaginal tissue. It just is naturally declines with age, and it is extraordinarily safe to take a vaginal, put a vaginal topical cream. You're not going to get systemic hormone levels. You get just enough to really, restore the vaginal tissue so you can have sex comfortably again. There are some exceptions. If you had like a cervical, cancer, uterine cancer, vaginal cancer, we might need to consult with the oncologist, but by and large, it's phenomenally safe. And then the last sort of big category that's not a medicine, although it's an intervention, is there's lasers. There's a number of different ones like Mona Lisa, and then there's a whole bunch of different brands. It's like a little wand that you kind of put in the vagina, and it emits, I don't do the procedure, so I'm not exactly sure, but it emits a tiny bit of energy that induces micro trauma. It's apparently not terribly painful or anything, but that micro trauma, with the healing process, your body brings in more collagen and lays down kind of new healthy tissue. And so when you embark on one of these treatment plans, you usually do a series of kind of 3 treatments in short succession, maybe once a month or something. And then there's usually a maintenance. Maybe you're going to need it like once a year or something like that. And afterwards, it's expensive. The machine is extraordinarily expensive. So the treatments are a couple $1,000s, I believe, but people get amazing results. And not only with painful sex, but also with incontinence. So a lot of the urogynecologists have the equipment and are offering this. It's not FDA. This equipment is not FDA approved for this use. So sometimes you'll see kind of headlines about that, but they have studied it. They are in the process of studying it and publishing papers, and it does look to be quite beneficial.
Is there anything like internal that you could do for something like vaginal dryness, like nutrition, or like what you could put into your body? Or do you typically just recommend like topical solutions?
When you say put into your body, you mean eating?
So I guess nutrition, I'm thinking, I guess in my mind, potentially could be medication, but I guess non-medication based would probably be mostly nutrition.
Yeah. There's a lot, there are supplements that, collagen, and some of the B vitamins, biotin is good for, skin, hair, and nails. I don't think, I've never heard of anyone saying that they noticed improvement in their vaginal, health by taking an oral pill. But some people, I definitely have patients who just, when you said put in, I thought maybe putting in, like they literally take their own coconut oil from their kitchen. They don't mix it. You buy the coconut oil from Whole Foods and you put it at the bedside. There are people who use olive oil for, vaginal moisture and intercourse, or coconut oil. Coconut oil can get a little bit, it doesn't necessarily clean, pass out of the vagina as easily. So, in terms of putting something up high in the vagina, you just want to make sure it's going to come out nicely. The vagina is kind of like a self-cleaning organ. And, I'm not about douching. I think people can sort of get into trouble when they start douching, because then you're kind of really disrupting the vaginal microbiome. But something kind of neutral like coconut oil or olive oil is probably fine to use for intercourse, as long as you're not using condoms, because then you could have compromise of the barrier with the condom.
Okay, well, perfect. That was very helpful. I hope that we answered both of those questions. If not, again, feel free. I'm going to give the contact information for both of our guests tonight. So if you guys do have any other questions or need more clarification on the questions that we answered tonight, please feel free to reach out to us. So again, thank you so much to both Dr. Fitz and to Jessica for joining us tonight, as well as to everyone who tuned in to view this webinar tonight. I hope that it was helpful. Again, this was recorded, so it will be posted on our YouTube channel by the end of the week. Later in the week, you'll be getting an email to all attendees with the link to the YouTube, as well as some contact information for both Jessica at Performance and Dr. Fitz at her practice, Women's Integrative Health. So again, Dr. Fitz is located in Stamford and Harrison, New York, and you can contact her either on her website's contact page or at info@women'sintegrativehealth.com. And as for Jessica, she is located in our New Canaan office, and you can find her contact information, our New Canaan office, either on performanceoptimalhealth.com, or her email is jessica@performanceoptimalhealth.com. And again, I know those are wordy, so those will be in the email that follows up, so that you guys can remember those contact info and can reach out to us as needed. So thank you again, everyone, for joining us, and I hope you guys have a great night.
Thank you.
Thank you. Bye, guys.
Bye.